Good morning, everyone. Hello, everybody. Welcome. Welcome to the final day of what has been a compelling and edifying World Cancer Congress. My name is David Winterflood. I am the director of No Man is an Island, Race to End HPV. And it's my privilege to be your chair for this morning's session, Boys, Men and HPV, the case, or a call rather, for global gender-neutral HPV vaccination. It bears repeating, HPV is the causal agent of 5% of all cancers worldwide. The virus is implicated not only in cervical cancer, but also penile, oropharyngeal, anal, vaginal and vulval cancers, as well as RRP and genital warts. And whilst we know that the majority of the cancers affect women, a significant number of HPV cancers affect men. Cancers which we do not have routine screening for, which means that immunisation is the only tool we have in our current arsenal for their prevention. Yet conversation around HPV and vaccine programs in most countries have focused on females only, with cost and vaccine supply historically cited as reasons why boys should not be immunised. Now is the time for these assumptions to be revisited. And today's session will comprise of two parts. First of all, you'll hear from Peter Baker, Director of Global Action on Men's Health, to run you through our new report detailing the evidence and indeed the case for action on gender-neutral vaccination and the need for a political and policy rethink at the global level. Following that, you will hear from some of the leading lights in the fields of HPV, cancer and public health to discuss this intervention in a panel which will include questions from the floor. But first and foremost, Peter, I hand over to you.
Thanks very much, David. It's a pleasure to be here and to see you all this morning. It's fantastic to see so many people interested in this issue and our call for global gender-neutral HPV vaccination. In the next 15 minutes or so, I'll explain why it's time for a change in global policy, why it's time for a change in the narrative around HPV and HPV vaccination. I will set out the case for a change in our approach to this critically important public health issue at the global level. This initiative is a joint one between Global Action on Men's Health and No Man is an Island, Race to End HPV. Both organisations have been involved in this issue for quite a long time now, and I've personally been an advocate for gender-neutral vaccination for about 12 years. I headed up the HPV Action campaign in the United Kingdom, which was a coalition of about 50 civil society and professional organisations, which successfully persuaded the government to introduce gender-neutral vaccination. It took a long time. It wasn't easy, but we got there in the end. And I then worked with Richard and other colleagues at the European Cancer Organisation to take this issue into Europe, and we helped to persuade the European Union to adopt gender-neutral vaccination as a flagship policy in Europe's Beating Cancer Plan. But I think it's now time to take a global perspective on this issue. Before I move on, I'd like to quickly thank MSD, AAA, which is Advanced, actually I can't remember what it is, but it's a Novartis company, Advanced Accelerator Applications, and No Man is an Island for supporting Global Action's work on men, cancer and HPV. But it's also important that I add that neither MSD or AAA has sought or had any influence on our policy work on this issue. We will give you a copy of our policy report later, but that's what it looks like. And it's published today and sets out our case for global gender-neutral HPV vaccination. This report has already been endorsed by over 20 organisations, 22 in fact, who have an interest in this issue. And you can see their logos on the screen. If your logo is on the screen, we thank you for your support. If it's not, and you'd like to be involved, add your name, please talk to us later. We'll be delighted to have a conversation with you about how you can get involved in this initiative. So what are we saying? Well, our key messages. first, the key point is that we now have the technology to protect everyone from high risk, that means cancer-causing HPV infections and the cancers they cause. HPV, of course, also causes anal genital warts and RRP, recurrent respiratory papillomatosis, which are both very nasty diseases. And of course, warts are incredibly common. They're difficult to treat. They're psychologically damaging to people, and they're very expensive. We also think, according to, well, recent research also suggests that HPV may be implicated in male infertility and cardiovascular disease in women. But I'm going to stick to the cancer issues today. HPV vaccination is probably the easiest way we know of to prevent cancer. To stop people smoking, to limit their alcohol intake, to bring about weight loss. These are very, very difficult things to do. And that's particularly true in my field, men's health. We know that men are much more likely to take risks in all these areas, and they're much more likely to delay seeking help from doctors, nurses, and so on. But we can protect everyone against HPV in a few minutes. In fact, a few seconds. That's how long it takes to stick a needle in someone's arm. And it's a very safe and highly effective vaccine. As David said, 5% of all cancers worldwide can be eliminated by vaccination. We have the means to end almost every case of cervical cancer, most anal cancers, over half of penile cancers, and up to 3/4 of oral pharyngeal cancers. That's a big prize. And it's not like a lottery prize, which only one in 10 million people will actually win. It's a prize we can all win if we take this simple and straightforward action. But to do this, we need a more ambitious, ethical, and equitable approach to HPV vaccination. And this means prioritising the elimination of all the cancers caused by HPV and considering all young people as a primary target for vaccination. And that's why we're calling for global gender-neutral vaccination by 2030 with a 90% uptake goal for everyone. 90% is the level at which the community as a whole is protected against infection. So why do we need to vaccinate boys? Well, men are the main vector, the main carriers and transmitters of high-risk HPV infection. It's quite an astonishing figure, but 20% of men at any one time have a high-risk HPV infection, and that proportion rises to 24% in Africa. This is a much higher rate than in women, and men are also infectious for far longer than women. The rate dips down in women in their mid-20s onwards. For men, it's consistent throughout their adult life. Men naturally clear the infection far less effectively than women, but they do have a very good response to vaccination. The man who discovered the link between HPV and cervical cancer, Harold Zahausen, said, I think a bit tongue-in-cheek, that in fact, if you look at the evidence, if you had to vaccinate just one sex against HPV, you'd actually vaccinate boys because they are more likely to transmit the infection. They are much more dangerous when it comes to HPV. It would benefit not only them and their own cancer risk, but it would also prevent cancers in women. Now, I'm not suggesting that as public policy, and he wasn't either, but it's an interesting point. Rates of penile and anal cancer are now rising significantly in men. And there's recently been a big concern about a big rise in penile cancer cases in Brazil. And HPV is the main culprit here. In at least 2 countries, the United Kingdom and the United States, the incidence of oral pharyngeal cancer in men has overtaken the incidence of cervical cancer in women, and this is being driven by HPV. We think the number of HPV-caused cancer cases in men has been seriously underestimated. We know that 20% of HPV cancer cases in India are male, and this rises to 42% in the USA. And you can see on the screen in France, the proportion is 28%, in Spain 30%, in Denmark and Ireland 35%. Based on data, well, there's not much data on this, but where we have data from 5 countries, USA, India, France, Denmark, Ireland and Denmark, we know in those countries combined, there are 42,500 HPV-caused cancer cases in men annually. And in those countries, there is 23% of the total global male population. Now, you don't need a degree in mathematics to work out that if you gross those numbers up, that suggests there's a total of around 180,000 HPV-caused cancer cases in men each year globally. That's far fewer cases than in women, of course, but it's still a very significant number. And it must be remembered, as David again said, there are no screening programs routinely available for men for the cancers caused by HPV. We need gender-neutral vaccination because girls-only programs cannot fully protect women. Even if 90% of women were vaccinated, millions would still be at risk from unvaccinated men. And we know that gender-neutral vaccination accelerates the elimination of cervical cancer. Girls-only programs also, of course, cannot protect fully all men, especially men who have sex with men, who are completely unprotected by girls-only programs and are particularly high risk of HPV-caused cancers. And of course, many men who have sex with men also have sex with women, so that's also a significant factor. And girls-only programs can't eliminate all the cancers caused by HPV, but we do know, modelling shows, that high-risk HPV types could be eliminated in 30 years, even if we vaccinated, through gender-neutral vaccination, only 75% of the population. But there are several other good reasons for introducing gender-neutral vaccination. It increases the resilience of vaccination programs. Vaccination rates can fall if there's a collapse in vaccine confidence, and we've seen that happen in several countries, Denmark, Ireland and Japan. Fortunately, it's picked up again in Ireland and Denmark. Or vaccination rates can fall as a result of a pandemic, COVID obviously, a war or natural disaster. But if a higher proportion of the population is vaccinated, this helps to mitigate the impact of a fall in uptake. Gender-neutral vaccination defeminises and destigmatises vaccination programs. Girls-only programs perpetuate the myth that sexual health and health generally is primarily the responsibility of women and girls. It can also help to perpetuate a belief that women are somehow to blame for HPV. Gender-neutral vaccination, on the other hand, shares the responsibility between the sexes and genders, and may even help to boost female coverage, as we've seen in Cameroon recently. And a change in policy is now entirely feasible because the WHO is recommending single-dose vaccination programs, which enables them to reach far more people. And global vaccine supply has improved rapidly. There are now 5 vaccine manufacturers, and the supply constraints that applied a few years ago no longer apply, and supply certainly won't be an issue by 2030. And it's not just us and the organisations that have signed up to support this call for action who think gender-neutral vaccination is a good idea. As I said at the start, gender-neutral vaccination is now European Union policy and is recommended for all 27 member states. In fact, all 27 states have now implemented it. 4 African region countries have or soon will have gender-neutral vaccination. Eswatini will be the latest, introducing it next year. In fact, around the world, over 70 countries have now implemented gender-neutral vaccination. But that's only about half of the countries with vaccination programs. And there's another 50 or so countries with no programs at all. And significantly, most of the countries with these programs, gender-neutral programs, are high-income countries, which creates a new inequality, as the lower-income countries fall even further behind in terms of the effectiveness and impact of their vaccination programs. If we're serious about achieving universal health coverage and tackling non-communicable diseases, if we're serious about health equity, then we need to protect everyone. So, in conclusion, the evidence for global gender-neutral vaccination is now robust and we think overwhelming. The time for action is now, and we ask you to support the call for global gender-neutral vaccination by 2030. If you want to find out more, please have a look at our website, which is now live. It's a new website, endhpvglobal.org. There's a link to the report. As I said, you can pick up a paper copy today, but there's a link to the report. You can download it and share it, hopefully. And also, there's a contact form so you can get in touch with us after today. So I'll stop there and hand back to you, David. Thank you very much.
Thank you, Peter. We now turn to the more interactive part of today's session, and it's my pleasure to introduce our panelists. We have Tristan Almada, co-founder of No Man is an Island Race to End HPV, Richard Price, Head of Policy at the European Cancer Organisation, Dr. Ibtihal Fadil, Chair of the MENA Coalition for HPV Elimination, Professor Bettina Borish, Chief Executive of the World Federation of Public Health Associations. Tristan, if I can turn to you first and foremost, you've been advocating for gender-neutral HPV vaccination for 16 years now. Could you share with the room why this issue is so important to you?
Yeah, take this. Thanks. And good morning, everyone, and thank you for being here. In my early 20s, my mother, aged 51 years old, sat me and my two sisters down and said, Kittykins, I've got cancer, but it's not a very nice sounding kind. And we're here at the World Cancer Congress, so I have a feeling that most people in this room are bound by a shared experience, either in a clinical setting or a personal setting, and you all know that there's no type of cancer that's nice sounding. Hers was anal cancer caused by the human papillomavirus, and due to the fact that by the time it was diagnosed, it had already spread to her distant lymph nodes. She presented originally as stage 4. Now my family, well-educated and very motivated, we were in New York, we had access to some of the best cancer hospitals in the world. We went to Memorial Sloan Kettering, optimistic, and after our first meeting with the primary oncologist, we were dejected to learn that our first-line treatment, the only line treatment available, was an antiquated chemotherapy regimen first given to patients in the 1970s. You can imagine what happened next, and in 2 years, she was gone. Now, Paulette's story is not unique. Through the work, advocacy work, and patient support work, not just with No Man, but also the Anal Cancer Foundation, an umbrella of other HPV-associated cancer organizations, every year, we encounter more patients. Every year, it seems like there's more HPV-associated cancer. And I also want to just mention, it's not only about mortality, which is my own personal case study, but also about disfiguring colostomies after surgery, chemoradiation to the pelvis or the neck, leading to sexual health dysfunction, and perhaps the worst side effect of all is the emotional isolation and stigma that this group of bad cancers feel as if someone deserved it. I guess the only thing that binds all these patient groups together, and the only risk factor that I see in the case of my mother or the other patients that we've encountered over the years, is that they're human beings. HPV is seriously bad news, but it doesn't have to be. And human innovation gave us this gift of a vaccine that I know so many other cancer organizations spending billions on research and therapeutics could only dream of. And so my sisters and I were like, okay, well, there's clearly something wrong here. How can we put our heads together and think about overcoming some of these barriers that are preventing vaccine uptake? And so No Man Race to End HPV was conceived of the idea that we can actually put ourselves out of business. And that is indeed our plan. And I think I just want to summarize by saying the most important lesson learned over the years of fighting this crusade on both sides of the Atlantic is that the more we move away from sexualization of this cancer and genderization of this cancer, and the more we reframe this in terms of humanity and a shared battle against our common enemy, human papillomavirus, all of these branding mistakes or issues will rapidly go away. Thank you.
Thank you, Tristan. Richard, can I turn to yourself with the European Cancer Organization, because your organization is very active in advocating for gender-neutral vaccination. And I wonder if you could share with the group an overview of ECO's work, especially about the efforts that you've undertaken in several Balkan countries, a region where HPV immunization is generally not as well established.
Thank you, David. So this year is an important year in a way because it's 5 years since the European Cancer Organization decided to make HPV cancer elimination a critical policy priority, and it's great to see Hein here, who was a board member at that time and was instrumental in that. And it's a sort of small seeds and trees story, because it started with an event like this, with the European Cancer Summit, where we had 300 to 400 leaders of cancer professional groups, patient organizations and others passing a resolution that this elimination goal needed to be taken up by the European Union. So that I had my instructions as to what should be done. And as we thought about how that could be achieved, the ethos of multi-stakeholder action was pivotal in our minds, because our membership is primarily healthcare professionals, but this involves patients, this involves academia, it involves government agencies, civil society organizations. We all have different roles to play in bringing this goal about. So we established in 2019 a HPV Action Network in the European Parliament, and have consistently found very strong political support from the Parliament and others. But critical to it has been the work of people like Peter Baker, helping us with the evidence, helping us produce reports that really make the logic insurmountable. And so our initial focus was, there was this opportunity, Europe's Speeding Cancer Plan, which was a blank sheet of paper in 2019. And we made the case with numerous meetings, full-on engagement program. I'm delighted to say, the more people you meet, the more people buy in. And I think the European Union has seen that this is a success story that they can belong to, of the scale of smallpox eradication and others. So that was a flagship part of Europe's Speeding Cancer Plan in 2021. But we've evolved with the need. So that was a big tick in the box to have that as an EU goal. But we weren't going to be mere spectators to see whether or not this goal happened. We felt we had to change as an organization. We're a Brussels-based organization doing Brussels-based things. But we wanted to get in country to help in those countries where they would be welcoming external support. So that started with a program called HPV Protect and Detect, where we've gone to Croatia, Romania, and Bulgaria, and helped really replicate that multi-stakeholder action at a national level. So we've worked very closely with national partners to get the energy going in parliaments and elsewhere on this. And it's been highly effective. In Bulgaria recently, for example, a national visit with bringing with us the data and reports, achieved the sort of media pickup and the political pressure to bring about a decision from the government that they would do gender-neutral vaccination. So the progress we've seen in that 5 years has been incredible. But we want to continue to help make sure that the vaccine uptake is as strong as possible. So we also have a program called Protect Europe, which gives a full suite of resources to clinicians and others in the system, how to engage with young people on vaccination, how to discuss it, and what the guidelines for rollout of vaccination should be. And now we're very focused on also trying to help the data do the work for us. So we have a tool called the European Cancer Pulse, which can provide information on how countries are doing in different levels of uptake, including for hard-to-reach groups, and on cervical cancer screening. And we've been bringing that data alive through, for example, color-coded heat maps to show which countries across a range of indicators are scoring well, which countries need to progress. It really helps to lead political discussion and bring about accountability for performance that could be so much better. We integrate our HPV messages within all of our political campaigns. This year has seen a European Parliament election, for example, and we're about to see a new European Commission come into place. And we've got 100 members of the European Parliament signing up to our manifesto, which includes making sure that that HPV cancer elimination goal is achieved. And then for the future, I think you mentioned about the Balkans, and what we're seeing as well is an appetite perhaps within regions to have cooperation, and that's where we think maybe an external organization like ourselves can help to bring people together in a way that might not otherwise happen. So we're very focused on that, and looking as well to support this call. I think what we're achieving in Europe, we think other regions of the world can do too. So working with you, ICC, to have this on the UN agenda, and also to see the tools that we've developed in Europe, can those be repurposed or for other parts of the world as well? So it's a very exciting agenda, and I think the more people we talk to and energize, the quicker we're going to achieve our goal.
Thank you, Richard. Speaking of appetite in regions, that spirit of cooperation, Ibtal, if I could turn to yourself, could you share with us why you believe gender-neutral immunisation matters in the Middle East and North African region, and where and how progress is being made?
Thank you very much. And we support, as a MENA coalition, we support the call for action. And this is why. The MENA coalition is representing over 500 members from the MENA region, Middle East and North Africa. And this is the coalition formed in 2018. Behind the main mission is to advocate for HPV elimination and reduce the burden of HPV. We have many challenges and barriers in the region, in our region, that lead us, or we need the more advocacy for elimination of HPV and reduce the burden. One of them, I say, Middle East and North Africa country, they have similarity in terms of cultural, social, and religious background. And this is a religious community or a conservative community where the issue of sexual health is somehow forbidden for conversation. And they have, most of the people, so whether the community and health professional, related HPV to sexual behavior. And this is one of the big issue and big limitation that we are working on in terms of advocacy. So as a coalition, we've been actively working since 2008 and 18 to work with different sectors, community and health professionals, to raise awareness about this issue. And the other things is lack of awareness. So the link between HPV and cancer is not well understood. Is also, this is among health professionals themselves. And when you talk to Peter about 50 countries who have not introduced the vaccine, unfortunately, most of the countries which I'm talking about have not introduced the vaccine. So we have 22 countries, only 7 of them have currently launched the HPV vaccine in their national program. And 3 of them, they are introducing the GNV vaccination. We have a strong interest in the region to advocate for to work on this barrier to increase the uptake of the vaccination in the region. Despite, that the country is, there is a similarity in terms of socio-cultural and religious. There is a wide variation in terms of the structure of the health system. So we have many countries who have a good health structure and others are suffering the resources. And this is a major limitation. Having unable to introduce the vaccine in this country because of limited health structure in terms of manpower and in terms of data. So the first activity has been done by the coalition is to create or generate a data. And there is a dashboard created for HPV and cervical cancer, as well as other related HPV-related cancer. And it is created on a dashboard to improve lobby and advocacy with the policymaker. Regarding the political and the policymaker, the political wills, there is a limited political wills and movement to introduce the vaccine by itself. I mean, not talking about GNV. The vaccine is, HPV vaccination is not well taken in, as a commitment by a political leader in the region. Despite the landmark of having a regional strategy for HPV elimination and cervical cancer elimination, which has been endorsed by almost all ministers of health in the region, the 22 countries. However, the action is not taking place, and it is very slow taking. This is why the coalition working on expanding and building the platform to work specifically on this area, how to advocate and how to improve the advocacy and lobby with the policy maker to increase and widen the uptake of the vaccine in the region. So I think basically we have a long way to go. And there is a need for the commitment and need for the network, which is in the region currently represented by the coalition, to improve the advocacy and lobby work for increasing the commitment for reducing the HPV-related diseases. Thank you.
Thank you, Abdel. And Bettina, if I could turn to you. Why does the World Federation of Public Health Associations believe that GMV is essential at the global level? We've heard from Richard and Ibtihal about the European and the Middle East and North African region pieces. Perhaps you could share from your organisation's perspective why we need a global approach.
Thank you so much. The World Federation of Public Health Associations represents over 5 million public health people. I would call it the public health crowd, because we don't all have a label here, master of something, because in fact, we all do public health, especially like you here. When we are advocating for health, we are doing public health. So welcome to our community. The World Federation has over 130 member associations. Mainly our main are members of public health associations, national ones. And they are helped by us to do the advocacy work you talked about in regions, nationally one. But we as the umbrella organization also see our task to do the advocacy at the level of UN organizations, multilateral places. So we are helped by that too, as we are accredited with some of the organizations that you see around here, especially working with WHO. And so our work is definitely how to get health also high on the agenda, together with all these people like you here. We do it globally, yes. But before I start, I have 3 arguments, and now, sorry, I may sound like the professor who is teaching public health. First argument is, there is no other medical intervention more effective than vaccination. Vaccination has saved, in the last 50 years, over 150 million of deaths. It is not only effective, it's also cost effective. So, we have something at hand that is working and has been proven, because you don't have any clinical cohort that is as large as the vaccinated people in this world. If we want, and we have done that with vaccination, eradicate a disease, and here we see that with one vaccination we can eradicate several diseases. So if we want to use the vaccine that will eradicate several diseases, we have to do it globally. I congratulate the work in the European region already done, and I think you're right. If you have a case here, it can help to transfer it somewhere else, and indicator dashboards help also. We have heard about the African region. We have heard from you about MENA region, that it has to be a global effort. We cannot just say, okay, this country has done it. We are all together. We are globally linked. So if we want to eradicate, we have to do it globally. And my last point goes to the gender question, my favorite one. Let me use an image. Do some people of you know soccer? Soccer is very famous in Europe. The image goes the following way. Would you ever, as a captain of a soccer team, decide to go for the next championship only with half of the team? No. Okay, so why do we go for eradication of HPV-associated diseases with half of the team? This is ridiculous. That doesn't work. We will not win. We will lose, because that's not the way it works. I think Peter has put all the figures out that gender-neutral vaccination, I like to call it gender-positive vaccination. It's positive to go all together. Why do we split societies? Why do we split people into female, male, others? This is not the way we are going to live on this world. So for me, the last point for gender-neutral or gender-positive vaccination is obvious. I mean, all the arguments are there. Our work here now is to get the right, to ring at the right doors, push the buttons, and to have the thing happening. And I think it's important for the global work to have people like you around, who can come up and say, it did work, so let's do it somewhere else. Thank you very much.
Thank you, Bettina. And I always really enjoy hearing you speak of that gender-positive immunisation term. I think that's a really helpful and optimistic way of reframing this discussion. We now open up the floor for your questions. We want to hear from you, so please don't be shy. If anyone has a question they'd like to ask one of the panelists or all the panelists. Rui.
I can open discussion. Good morning, everyone, and congratulations for this session. We have been involved in HPV with DECO and Peter, and also before of that, and it's very nice to listen the words of Bettina on two issues. One is the issue not everybody has a master on public health, but do work on public health. So it's a very key issue, because some people think if you have to have a master or PhD on public health to work on public health. It's interesting, and I will keep your words. The other thing you have said is the issue on soccer or football, which is a very good image for all of us. So my question, if we all believe on that, what is failing? It's a matter, like I was questioning yesterday, it's a matter of budget or the right decision of our politicians. So in your opinion, maybe Bettina can have an opinion. It's our we know the final decision will be on the government. They will decide if they want to pay the budget or not. It's right. So in your opinion, what's failing in those countries where no gender positive attitude it is?
That's a broad question. Thank you very much. The gender issue, the attitudes to gender are, as you would say, different from country to country. And it very much is linked to the position of both genders in society. And as far as we also have family laws or equal standing for all, I always like to call women the minority that is a majority. If we have equal rights, then things move more smoothly. Then there is the question how gender is used. And I think the HPV case is very interesting because we see for the first time that you can disadvantage men by just using gender. Usually women experience the fact being disadvantaged, but in this case we see that whatever gendering you do, some part of society is disadvantaged. So we should take it off, number one. The second question was about the political will. And I think that the classical thing in political will is put the incentives right in healthcare systems if you want to change things in healthcare systems. Put more effort on prevention than on curing. So if you would shift in a given healthcare system, a 10% of the amount that goes to cure of a stage 4 cancer to preventing it, you would already have done a lot. How you make this understandable to a politician? Well, that's our work. That's our work because, as we know, again, with the European Parliament, new elections, we have to go again. There are new politicians who never heard about it, so we have to go and teach them. It's kind of giving school lessons. Explain them. What is HPV? Human papilloma virus. Okay, that's it. And explain. We did that with breast cancer. The resolution on breast cancer, 2003-2006, the first ever resolution of the European Parliament for a single disease. This is our work. This is our work. We have knowledge, we have empathy, and we can go, but we have to do it again and again because we know politicians change, at least in most countries they are elected. And we cannot even blame them for short-termism because they're the next ones coming and they have to learn what has been done. So for me, it's also a call to all of us, go and see the places where you know you can influence, you can get people over. Then thank you.
Round of applause. And Ibtal, please.
Yeah, I want to respond to that. I think from our perspective is the lack of knowledge and limited evidence at that time. So you see when historically when the cervical cancer strategy started, it started the whole issue of HPV is related to cervical cancer, and it is a good move. But now there is more evidence coming in place, and I think we are in the right time to say, you know, the progression. Now, HPV is not a cervical cancer only; it's a main-related diseases. So, as a you could say a public health community, we started this move, and I think this is a good move to collect all the evidence and information. It's irrespective of the gender issue. It's changing. You know, we are moving the stage and saying it is a man and a woman disease. It's not only related. And this is the point which I clearly said about limited knowledge and information in our region. Data is not there. So our responsibility as a public is to project this data and project the evidence and changing the move now to a bigger picture. It's not a cervical cancer, HPV. It's related to all other cancer. One point which is also of interest, like the country in our region who already started GNV, they started from the point, I think it is a good tactic that parent will not question a lot because it's now part of the immunization boys and girls, so it is similar to any other immunization. And I think although they use it a tactic, but it is also based on evidence. It's not something which is we as a public health discourage. Thank you.
Can I have
Trist, do you want
a word? Yes, you both said the exact words. I can say to you the example of Portugal in 2009. First, our minister didn't want to approve vaccines and everything. We sit with them and explain and educated him in all the advantage. The other part is, you have said, is very interesting because also the national organizations, the society, community, did sign this movement to approve the gender positive vaccination. So you are absolutely right. So we have to educate our politicians. And the good example we have now of Portugal is a good example that can be, it's not a rich country, but it works. And the other thing you have said, it's a key issue. HPV vaccination is a vaccine like the others, is natural to be vaccinated. It should be considered like the other vaccine, not a special vaccine, it's natural. And even at Portugal, as you know, most of us are Catholic, it was considered that the church would be in opposition due to the sexual, which was not. So it's natural to be vaccinated, and you are right. The idea is exactly, it's like the other vaccines.
Jesse, you wanted to come in?
Yeah, I'll be brief. The one common theme that I've heard today and also yesterday is that people don't know it's bad. People don't completely comprehend the cost of inaction. And there's two reasons for that. One is a long latency period. You contract HPV when you're 20 and you may or may not get cancer 20, 30, 40 years later. And two, it's embarrassing. So it's hard to, there's a lot of patients and cancer survivors in the woodwork who are not willing to share their story due to social stigma, et cetera. So if I could just leave you with a thought experiment, which is, imagine this is a virus like COVID. So rather than waiting 20 or 30 years from the point you're infected to the point you get cancer, you wait 20 or 30 days. Think about the types of actions you would take to prevent. I mean, it would probably have enormous impacts on sexual behavior, but hopefully also everyone would get vaccinated very quickly. Thank you.
Thank you. Richard, please.
If I may, I just wanted to pick up your comment about sort of re-educating politicians every time there's an election. I just wanted to share an experience that we had recently after the election. There were a lot of new politicians and new parties, let's say, in Strasbourg, and we were. Our approach has always been to work with everybody. We think cancer affects everybody, and we take that approach with politicians too. And we asked for meetings, and we knew that we were having a meeting with a very MEP, very active in anti-COVID vaccination discussions and debates, and we wondered how this was going to go. But we thought we'll meet her anyway and talk to her about the HPV campaign that we were running. And what was important was she was able to recognize that it was an area she didn't know that much about, and she was willing to listen. We took her through our papers, we took her through the data, and she made a distinguish between the two. And I think the lesson there is talk to everybody. I think that the arguments that we've got here can resonate with all parties, and that's very powerful. We've got the far right, the far left, and everybody in between supporting our manifesto here. So yeah, I would encourage that anywhere in the world.
Thank you, Richard. Any more questions from the gentleman here?
Good morning, everybody. Thank you so much for this wonderful discussion. And now I come to my favorite part, which is when it comes to immunization and vaccination. With that comes resistance and vaccine hesitancy. There was a very well example put forward by Ibtihal about the MENA region that definitely there are certain groups who are very much resistant to vaccination. And I must assure you that it's around the globe. It's in Asia, it's in Europe, it's in Americas. So because we're talking about the global action, I would ask you, Ibtihal, if you could please share, and perhaps the other panelists also, to actually guide us through the strategies, actually, because it's real, the resistance and hesitancy, how you are actually trying to cope up. If you could share with us how you're doing that, so that the best practice could be shared, and maybe in coming years we could achieve that goal of vaccination and immunization. Thank you so much.
Yeah, thank you for the question. I think hesitancy for the vaccine is applied to all vaccine. You know, we saw the experience in COVID, and how country and especially in our region manage that is by talking to public, raising awareness, and this is the best strategy. One of the best strategy is to get the confidence and the trust and the buy-in of the community leaders. And you know, in our region, community leaders could be a religious and non-religious people because of the structure, what we call it the community group, and they are very powerful. So these are the people we are using now currently in lobbying for the HPV. To your surprise, I think a colleague here in the room have attended, we do continuous, what we call it a dialogue with the manager, focal point, and with policymakers. So I remember in one of the last dialogue we did in May in Saudi Arabia and Riyadh, to my surprise, most of the healthcare professional and provider who are sitting in the room, they were not aware about HPV main related diseases. So there is many ENT people who are very familiar with diseases like not cancer, before the cancer, which is HPV related. These people have been used by us as an organization to educate the community leaders about the disease and the linkage between infection and the cancer. And the point which we have used mainly with these people is to make we are talking about preventing cancer by this vaccine. So the vaccine is not something to do with sexual disease, it's something. And how wonderful and great, as in the globe, to have a vaccine for a cancer. So this is the point where even in Saudi Arabia, we could say the very conservative community, the vaccine has been introduced based on this argument. And this argument has been well sold through the community leader and religious leader, that you have the priority to prevent a cancer, and this cancer have a vaccine. So this is the point which we sell it.
Absolutely, and I think how great and good to have vaccines to prevent cancer. Peter, I'll turn to you for final comment, just aware of our time.
Yeah, just a quick point to add. It's a great question. You can have the best vaccine in the world or the best drug in the world, but if nobody wants it, it's pointless. So we've got to make sure that not only do we introduce the programs, but that we have a high level of uptake. And I think, just to add to what's been said, we need to first of all make access as easy as possible. So remove as many barriers as we can to young people getting the vaccination, which means in most countries using a school-based program where that's possible. And the second key point is to make sure that healthcare professionals have the right conversations with young people and parents and carers, because they are best placed to actually correct or put right the myths and disinformation that is swirling around in social media. And we find, in Bulgaria, for example, we found that a lot of family doctors were telling parents that HPV vaccination would make their daughters infertile. So we have to train the healthcare professionals. In Ireland, it was similar. A lot of community nurses in Ireland, when they had a big dip in vaccine confidence, were giving wrong information to parents about the consequences of vaccination. So we have to train the healthcare professionals to understand HPV and vaccination and why it's a perfectly safe and effective vaccine.
Thank you, Peter. A perfectly safe and effective vaccine. And that's something we should all be getting behind for protecting everyone. Let's give our panelists a round of applause for their thoughtful inputs today and your thoughtful questions. And I'm afraid, dear guests, that we must draw our session to a close. You have heard the case today for our call, for a global call for gender-neutral, for gender-positive HPV immunisation. If you wish to join the 22 organisations who've already endorsed our report, please do come up. Please consider signing our recommendations here with us today. Please do speak to us about how your organisation can join with us on this initiative to protect our sons and daughters against this insidious virus and the devastation that it causes. So thank you very much for your attention. Hope you enjoy the rest of the conference.